Hi, and welcome to a weight loss program here at AtlantiCare. My name is Alvaro Galvez, and I am a board-certified general surgeon with a subspecialty in bariatric surgery. I'm here to talk to you a little bit about weight loss surgery. What is the impact of obesity in America? Let's start the presentation by talking about this. In the past 20 years, adult obesity has doubled in the country. 3 out of 5 Americans are either overweight or obese. This has led to approximately 300,000 plus premature deaths annually, and this number is only on the rise. 75% of obese children have been proven to become morbidly obese in their adult life. And this is important given that it leads to important medical problems such as hypertension and diabetes. How does America compare to the rest of the world? We can see in this slide that the United States is amongst the highest rated in terms of prevalence of obesity. We are at 68% of the adult population versus other big nations. What is the cause of obesity? Well, it's not an easy answer to give you. There are multiple reasons why a person becomes obese. It is multifactorial, meaning several factors involved. There are physiologic causes, of course, causes associated with the body's makeup. Genetics, you can be genetically predisposed to be obese. Gender plays a role in this as well. And finally, hormones in the body can have different problems that can lead to obesity. Environment. This is also an important cause and contributor to obesity. In today's day and age, technology has allowed us to be way more sedentary, not having to leave our homes to be able to do a lot more than what we used to do before. Aside from that, we have become or have easier access to easy food sources. We are able to order food from our phones. We are able to drive to a fast food restaurant and get food quickly, especially when we're most hungry during the day. And finally, several behavioral factors that we develop in life. A lot of our patients develop a difficult relationship with food, where food becomes close to a drug. It's something called a food addiction. Food also being viewed as a way to reward oneself, as a way to comfort oneself. So all these adaptive eating patterns become a problem later in life and lead to obesity. And finally, also family tradition, cultural traditions. This also has led to a rise in obesity in different groups in our population. It is not strange to see that children are raised with different values in terms of finishing the food or getting overfed, and this leads to obesity later on in life. Why is it important to lose weight? Well, mainly for health, of course. Obesity has been proven to be associated with multiple medical conditions, which we in the medical field refer to as comorbidities. You will hear that word a lot throughout this path. The importance of having all these comorbidities is because the risk of death is increased with each one of these that is tacked onto your body. It has been proven that the risk of early death is doubled compared to patients who are not obese. Now, there's different causes that can lead to death, but diabetes and heart attacks are an important cause of mortality later on in obese patients' life, and has been proven to be 5 to 7 times higher than compared to someone who is not obese. So obesity, as we mentioned before, has been proven to be linked to several other pathologies. In this slide, we can clearly see these are just a couple. We have more slides forward in the presentation that will show you the different pathologies associated with being overweight. Diabetes, extremely important, as well as heart disease, very highly linked to obesity. The risk of stroke, high blood pressure, arthritis, sleep apnea, high cholesterol, heartburn, gallbladder issues, depression, asthma, and also, several types of cancers have been associated with being overweight. Some examples we have up there, such as esophagus, stomach, colon, liver, gallbladder, breast, uterus, are just a couple that we can mention. And this is a problem when we see that close to 80% of our adult population is reaching either being overweight or obese. Now, specifically talking about obesity and cancer, this is very important to us. We see that 52% of patients that are obese have a higher death rate, especially for men, and 62% for women. So this is something to take into account. This is something very important for us. This is why we treat this very seriously. In terms of the association between obesity and diabetes, it has been proven that 70% of the diabetes risk in the US is due to excess weight. So obesity is a huge factor in diabetes, and diabetes is a well-known pathology that has several ramifications and several impacts on your health later in life. In terms of defining obesity, what do we say is obese in the medical field? Well, what we do is when you come to see us in the office, and part of our workup starts with actually measuring your weight and measuring your height. And this gives us a number called the BMI, the body mass index. This is the primary number which we use in order to guide the treatment for the patient that is overweight. This is a calculation that is very easy to do. You can do it on your own. And the number that you calculate with different calculators that are available online is important for us to be able to determine what degree of being overweight you have. We can see in this graph the different degrees of obesity, where the BMI is categorized in different pictures. We can see here in the right side of this slide that severe obesity starts at a BMI of 35. And these are the patients that actually qualify for surgery. Having a BMI of 35 is now labeled as a medical condition and qualifies you to be a candidate for bariatric surgery. If you have a BMI of between 35 and 39.9, you must have a comorbidity associated to that BMI in order to qualify for bariatric surgery. But past the BMI of 40, only the BMI alone qualifies you for weight loss surgery. What are your options to treat obesity? You have a surgical and you have a non-surgical route. Why does surgery exist in the treatment of this pathology? Well, mainly because the non-surgical options, which are basically exercise, diet, and medications to lose weight, have been proven to have a 95% failure rate. This is very frustrating for patients, and it led to the development of bariatric surgery as a subspecialty field in surgery. Because after several studies and several scientific papers, it was finally publicly announced by the NIH, the National Institutes of Health, that only surgery has been proven to be effective for the long-term success of patients with clinically severe obesity. Now, this is not the only agency that has statements of this sort. In this slide, we can see the different entities that are also backing bariatric surgery as the most effective and the most enduring treatment that we can offer patients with morbid obesity in order to regain their health. A frequent question that our patients usually have is, how much weight can I expect to lose? That question is very difficult to answer because everyone is different. Every one of our patients is different. Everyone responds differently to surgery. But just looking at numbers, we can say that on average, after bariatric surgery, and it depends on the type of bariatric surgery that you have, but for the first part of your recovery period, in the first 3 months, you will lose about 5 to 15 pounds a week. And it will slow down to about 1 to 2 pounds a week after 6 months. And this is, of course, highly variable, but it's what the average that we have observed throughout several studies. And at 1 to 2 years, we can say that all of our studies have concluded that you will lose between 50 and 70% of your excess weight. This comes to roughly about 30 to even 60% of your actual weight. You can achieve a loss with bariatric surgery. Now, what is the impact on that on the body? What is the impact of losing weight on all the different comorbidities that we talked about? First of all, before going into comorbidities, let's look at the quality of life that our patients have reported. 95% of patients report that their quality of life has greatly increased at 1 to 2 years after surgery. And the mortality in a 5-year period after bariatric surgery has been reduced in 89%. These are extraordinary numbers, and this is why we offer this surgery, and this is why I'm so passionate about this subject. On this slide, we can see the different pathologies associated to obesity and how they start to resolve after the weight starts coming off. Well, just a couple of the very important ones: hypertension, high cholesterol. We see numbers close to 70% of resolution. Type 2 diabetes, 82 to 90% cure of diabetes. Feel free to pause the video to look at the numbers and examine all these pathologies and see how these could pertain to your case. Now, in this slide, I am just highlighting the most important and the most common pathologies that we see associated to obesity and how they resolve. As we mentioned, high blood pressure, 75% resolution or improvement. Diabetes, 80% resolution. We're talking about cure. We're talking about being on No medication for diabetes. High cholesterol, 70 to 80% resolution or improvement, decreasing the dosage of your medications. Sleep apnea, resolution or improvement, either decreasing the settings of your CPAP machine or not needing it at all. These are amazing numbers, and we are so happy to offer this to our patients. So you might be excited with surgery. You might say, I want to do it. Do I qualify? Do I qualify for surgery? Who qualifies for bariatric surgery? Who qualifies? Bariatrics and weight loss surgery is a term used interchangeably. It means the same thing. If you have a BMI of 40 or greater, you qualify for surgery. If you have a BMI of 35, but not quite 40, you must have certain comorbidities such as high blood pressure, cholesterol problems, diabetes, sleep apnea, arthritis. These are a couple of examples that could qualify you for bariatric surgery. You must have a history of trying to lose weight on your own and not being successful at it. Importantly, very important that you understand the risks, the benefits, the side effects, and the rules before and after surgery. And ultimately, you must be at least 18 years of old to consent for the surgery. Who does not qualify for surgery? Sadly, we do have patients that do not qualify, but it is not a big list. As we discussed, the BMI under 35 does not qualify you for surgery because we can still attempt to lose weight via non-surgical alternatives first before we reach the BMIs above 35. Ongoing drug or alcohol abuse problems are an automatic disqualification for bariatric surgery, given that the use of alcohol and drugs affects your body differently once your anatomy has been restructured after bariatric surgery. Smoking is a big problem too. You will not be able to smoke after bariatric surgery. It is very important that you are a smoker, that you quit. The effects of nicotine and the smoke on your new anatomy can be devastating, and it is a disservice to perform these surgeries if you are a current smoker. So we do not offer these surgery for these patients. Untreated or undertreated mental illness. These pathologies need to be addressed and controlled before we can go ahead and perform such a life-altering procedure as bariatric surgery. If you want to become pregnant within 2 years from when you're planning to have surgery, bariatric surgery is discouraged because this can curtail the amount of weight that you will lose with the surgery. So we encourage our patients to go ahead and become pregnant and have their babies. And once they are ready to at least be not be pregnant for the next 2 years after surgery, that they come to see us then. And finally, if there is any sort of mental or cognitive impairment that impairs the patient's ability to understand the surgery and to give us consent for it. Very important, you need to be willing to undergo the surgery and understand what you're signing up for. Finally, the commitment. Commitment is important because surgery is not a magic bullet. Bariatric surgery is just one tool in the armamentarium of bariatric medicine to help you lose weight, but also to help you keep it off. Once bariatric surgery has been performed, you will lose weight, but it will be up to us together as a team to help you keep that weight off. And that needs to be done with diet, changing your current diet and eating habits, exercise, working that into your daily routine, follow-ups with us routinely in the office. We'll go into the schedule a little later in the video on how the follow-ups happen, but you need to come back to us, check in with us every certain amount of time to make sure that your lab work is okay, to make sure that your supplements that you are taking are okay, to make sure that your vitamins and mineral levels in your blood are all okay. You need to come back. You cannot stray too far so that we can keep you on the right track. And ultimately, you need to have a strong support system that helps you and understands what you're going through and builds a supportive environment so that you can continue on this path towards health. Let's review the digestive system because this is where all the magic happens. In this slide, you can see a picture of the stomach with an arrow pointing through it. This is the path that food follows as you swallow it and it enters your gastrointestinal system. Here, the stomach on top, the large bowel on the outline of the slide, and the small bowel in the middle. These are the important anatomical landmarks that we need to look at when we're talking about bariatric surgery. Bariatric surgery performs two big operations. One is the sleeve gastrectomy seen in the middle of the slide here, and a gastric bypass seen on the right side. The sleeve gastrectomy consists of stapling off 75% of your stomach and making it from the size of approximately a football to the size of a banana. This restricts the amount of food that you can eat, but at the same time has a very important metabolic and hormonal effect that changes your brain chemistry to tell your body to start losing weight. It not only acts by just simply restricting the amount of food that you eat, it also acts via hormones in your body that tell your body it is time to start losing weight. And the gastric bypass seen on the right, this is a procedure in which we take the shape of your stomach and staple it to resemble about the size of a golf ball. And this, of course, limits the amount of food that you can eat. But this small golf ball sized gastric pouch is then anastomosed, meaning plugged into the small bowel, so that you bypass a large segment of your stomach and your small intestine. On the slide, we can see that the green arrow is the bypass segment of stomach and small bowel, and the darker green after the red and the green coalesce are when the digestion starts to happen. So aside from combining a restrictive procedure in which you are restricting the amount of food that you can eat, you are also restricting the amount of absorption that you can do of the food that you eat. So this is why it's called a combination malabsorptive and restrictive procedure. Now, limiting the amount of food that we eat, that can sound scary, but by the anatomy of the stomach changing like this, you will feel satisfied with a lot less food. This doesn't mean that you will starve. This doesn't mean that you will go hungry for long periods of time. You will be satisfied with the amount of food that you eat. Lastly, discussing the picture on the left side is a procedure that at our weight loss center we have now abandoned, given the number of complications seen down the line and unfortunately the weight regain that we saw in patients. The gastric band. Gastric band was a bariatric procedure started to be performed about 20 years ago, which initially had a great success rate. Patients would lose weight. It consisted of basically a plastic belt that was tied around the top portion of your stomach and would limit the amount of food that you can eat. Unfortunately, this foreign object that was implanted into the stomach had complications in terms of slipping up or down the stomach or even eroding into the stomach. And that gave us significant problems down the line. But aside from that, we saw that patients after a period of 2 to 5 years would regain the weight that they lost and ultimately be converted to a different procedure, be it a sleeve gastrectomy or a gastric bypass. Now, it is important to mention that a sleeve gastrectomy is a procedure that can be converted. If you're interested in the sleeve gastrectomy, this doesn't mean that you can't have a gastric bypass down the line as a means of adding even more weight loss if you are not happy with the results. The sleeve gastrectomy can be converted to a gastric bypass. And the gastric bypass is a procedure that ultimately down the line, if it were to be required, can be reversed. Not so much the sleeve gastrectomy, because as the stomach is removed, you cannot grow a new stomach, and therefore the procedure is permanent. The gastric bypass is a procedure that can be reversed. In this slide, we will review a video of what the surgery for a sleeve gastrectomy entails.
The sleeve gastrectomy is a restrictive procedure, which limits the amount of food you can eat by reducing the size of your stomach. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, Behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Now on this slide, you can see what the surgery is for a gastric bypass, what happens in your body, and how we perform this bypassing of the stomach and the small bowel.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Now, what procedure do I choose? That is a frequent question we see in the office. Ultimately, it boils down to personal preference. What do you prefer? What experience have people around you had with the different procedures? We will talk about that all in the office, where we will review your specific case and tell you exactly what we think would be a good procedure for you. But I can tell you right now, most procedures work well for most patients. It ultimately boils down to what you feel comfortable with. There are a few small caveats I want to go through with you in this slide on certain situations in which I would recommend that you consider one procedure versus the other. Even though the sleeve gastrectomy can have just as great results as the gastric bypass, just by numbers alone, it has been proven to provide a little less weight loss than the gastric bypass. At 1 to 2 years, the amount of excess weight loss with the gastric bypass has been reported to be up to 70%, versus with the sleeve gastrectomy, it is at 60%. Now, these numbers are fantastic, but just by numbers alone, the gastric bypass can provide a little additional weight loss than what the sleeve would. Now, if you're interested in the sleeve, the ideal candidate for the sleeve would be someone that has maybe had a lot of abdominal surgeries with a lot of scar tissue that could make the gastric bypass a harder and a little riskier procedure to perform. While people who are looking into the gastric sleeve, I would actually sway towards thinking about the gastric bypass if they have a history of severe heartburn, given that heartburn is a problem that can arise with the sleeve gastrectomy. If you have issues with heartburn as it is, the gastric bypass would take care of your heartburn and provide excellent weight loss results. Also, patients that are diabetic and under insulin treatment tend to do a little bit better with a gastric bypass, being able to come completely off their diabetes medications sooner. Now, we talked about the excellent results of bariatric surgery. We also need to mention some of the possible complications. After the surgery, you can suffer clots in the legs that can travel to the lungs, called pulmonary emboli. We take precautions to avoid these as much as possible, but unfortunately, surgery is a risk for this. You can also, you run the risk of having infection of your surgical incisions. There can be bleeding at the staple lines when we perform the surgeries. You can suffer dehydration after surgery due to inadequate fluid intake. There can be injury to other organs as we're performing the procedure. There can be vitamin and nutritional deficiencies down the line after bariatric surgery. There can be transient intestinal blockages that might even require you to have another surgery to become unblocked. And ultimately, the staples that we use for our procedures can leak. Now, all these complications have extremely low rates, under 1% nationwide. But it's important that you understand that surgery is is not a risk-free endeavor. Possible side effects of surgery: dumping syndrome. Given that we rewire the anatomy of the GI tract, sometimes eating big loads of food that is rich in carbohydrates can cause you to get sick transiently. That is what we call dumping, and we can discuss it more in the office. That is something that we need to be aware of, especially in the first couple of months after surgery. You can have temporary hair thinning that can be due to vitamin and mineral deficiencies, which we will have to supplement for it to resolve. Transient nausea, vomiting, heartburn, as we discussed, especially with patients undergoing a sleeve gastrectomy. Your bowel habit can change slightly, having intermittent bouts of constipation or diarrhea, which tend to resolve a couple of months after surgery. As you lose the weight, you can also have excess skin, which might be bothersome. It might require a consultation with a cosmetic surgeon down the line. And ultimately, psychosocial implications where having undergone bariatric surgery can be viewed as a negative or even a social stigma, which is something that we're aggressively fighting against because this is our field of interest, this is our passion, and we know that our patients do extremely well and regain their health by undergoing these procedures. So if you're interested in bariatric surgery, what are the requirements in terms of insurances and pre-certification? First, consult with your insurance company and see if bariatric surgery is covered. Not all insurances will cover it. It's important that you talk to your insurance company and see if they cover this type of service. You must meet the criteria to qualify for insurance clearance for this, as we mentioned before. And once you are cleared and you can come see us in the office and we have a conversation, the steps in order to get you to surgery require a little homework. When you come to the office, we will discuss the procedure that you're interested in. We'll talk about the pros and cons and answer all the questions you may have. And after this, we will enroll you in the program and start you on the process of getting you to surgery. This involves the help of our dietary specialists, which will have a meeting with you and go over a nutritional evaluation, where we'll go over your current diet and give you recommendations on how to improve that. You'll also talk to our team psychologists. We'll do a psychological evaluation to make sure that you are mentally ready for the surgery that you wish to pursue. We will also ask you that you talk to your primary care physician and get a letter of clearance so that they think that you are a good candidate to undergo this procedure. And ultimately, we might or might not ask for a couple more consultations with other medical services such as cardiology or pulmonology. They will study your heart and lungs and make sure that you are as optimized, as ready for surgery as you can be. We will also request an endoscopy to assess the anatomy of your stomach, esophagus, and small bowel to take a look and make sure that we have a roadmap of what we're going to deal with once we start with surgery with you. You will have to come to our office every month until leading up to surgery so that you get your weight checked and you talk to our different specialists, nutrition, psychology during this time to get you ready for surgery. And at approximately 2 to 3 months is the typical wait period before we can bring you in and talk and set a date for your surgery. Finally, it is important that you, if you are currently a tobacco smoker, that you quit all tobacco use for life. This is important because, as we discussed, the tobacco and the nicotine can have very negative impacts on your new anatomy once you have bariatric surgery. So why should I come to AtlantiCare for my weight loss surgery? Well, at AtlantiCare, we are an accredited center of excellence in bariatric surgery. We are fully equipped in terms of facility, furniture, staff, training, education in order to care for you with the top standards in bariatric care. We have a robust team of specialists well experienced in the care of bariatric patients that will help you across every step of the way. We have pathways and policies so that your transition from before surgery to after surgery is as smooth as possible. And aside from that, we are also a state-of-the-art technology center where we offer both laparoscopic and robotic surgery to our patients. All our bariatric surgeries are performed in a minimally invasive fashion using only tiny incisions, but we actually now have the robotic platform available to us to also perform these surgeries robotically in order to ensure the maximum amount of safety for you during surgery. Our surgeons' experience at AtlantiCare is pretty robust. Over 6,000 procedures performed by our center to date. All our bariatric surgeons are board certified and specialty trained in bariatric surgery. The length of stay in our hospital is actually quite impressive. You will stay actually 1 day after your sleeve gastrectomy, and usually between 1 and 2 days after gastric bypass. And you will return to work in a short time, given that we only use small incisions for your surgery. So what is the pipeline to get you from being interested in bariatric surgery to recovering from it? You will attend an info seminar, which is done online and which you are attending right now, and then make a consultation to come and talk to us in the office. We will go over your case, we will review all your information, and we will get you set up to get the testing required to undergo surgery. After this, there is a approximately 2 to 3 month wait time in which we get tests, and we have you talk to our dietitians and psychologists to get you prepared for surgery. Also in that time, we have you talk to your primary care physician so that they give you their blessing to undergo surgery. And we might or might not obtain the help of a cardiologist and a pulmonologist to evaluate you to make sure that your heart and lungs are in the best shape that they can be before your surgery. Once all this is met, you will come meet us in the office for a final preoperative visit in which we will review all your information and get you set up for surgery. At this time, you will also attend a 1-hour boot camp educational session in which we will review all the important concepts for you to bear in mind before and after surgery. And then we will have a written test which you need to pass in order for us to offer the surgery for you. Once all of this is met, you and us, we will set a date that works for you for your surgery and ultimately see you in the hospital. In the hospital, you will stay between 1 and 2 days, usually about 1 day, and then you will go home and come and see us in the office 1 week after your surgery to make sure that everything is right on track. After this, we will see you at 1 month from that time, and then 3, 6, and 12 months after your surgery. We will routinely check labs and make sure that your nutrition is optimized. And after this period of 1 year, we will see you once a year in order to ensure that you're meeting your nutritional requirements and that you have adequate nutritional supplementation after surgery. So once again, thank you for your interest in our weight loss center. We welcome you to AtlantiCare, to our bariatric surgery center, and are happy to talk to you in our offices. My name is Alvaro Galvez. I'm one of the bariatric surgeons at AtlantiCare. It's been a pleasure to talk to you, and I hope to see you soon. Take care.